One of the areas that we can focus on with patients with robotic surgery is an area of your body called your mediastinum. Your mediastinum is the part of your body that's right underneath your breastbone, and of course it goes back to your spine. But remember, your heart has a sac around it called your pericardium, and your lungs have sacs around them called your pleura. So this is the tissue that involves that area that's really not inside those sacs, that's outside the sacs, but under your breastbone, and that's called your anterior mediastinum, in the front underneath your breastbone. There's a posterior mediastinum. But people can also present with a multitude of different difficulties or tumors or masses, what have you, in that area as well. And a lot of times we'll find patients that have what we call enlarged lymph nodes. And I always describe lymph nodes as little filters, or it's lymph tissue. But a lot of times when you do have an infection or inflammation or something worse, like cancer or lymphoma, these will start to enlarge. It's either resectable or it's not resectable. If it's resectable, you should be able to do this with the robot. And the advantage is, now, the classic way of doing, for instance, let's say you find an anterior mediastinal mass that we either need a biopsy or we need to remove it. Sometimes the tumors are benign, but they're growing at a rate that's going to cause trouble. And so sometimes the benign tumors need to be removed. But the classic way of doing the surgery is where, of course, with you asleep, but we make an incision. We have to divide your breastbone in the middle. So we make an incision from here to here. It's a large procedure. A lot of times we can go in with the robot and we get excellent visualization, and we can remove this through the ports without making the large incision.